referring to, well, I'll give myself 5 minutes. Okay, thank you. Now, President Trump has just tweeted out a statement that I'm going to quote in reference to my chart about comparing these cases. He says that the United States has far more cases than Europe, and I'm quoted here, because we do much more testing than any other country in the world. If we had no testing or bad testing, we would show very few cases. Now, Dr. Fauci, do you agree with the President's statement, or do you stand by your previous answer that the difference is caused by multiple factors, including the fact that some states did not do a good job of reopening?
I stand by my previous statement that the increase in cases was due to a number of factors, one of which was that in the attempt to reopen, that in some situations states did not abide strictly by the guidelines that the task force and the White House had put out, and others that even did abide by it, the people in the state actually were congregating in crowds and not wearing masks. I might also just bring something that I thought about and mentioned to you before, Mr. Chairman, that when we talk about crowds and masks, it's always better outdoors than indoors, and being crowds indoors is always worse than crowds outdoors. That's the case because of the circulation of air. So we should avoid crowds under any circumstances, but wearing a mask is the critical issue, right?
I agree with that, and I think that I will go to restaurants who allow me to sit outdoors,
right? Yeah.
And not indoors. So I've been following the science, and I've been agreeing with all three of you as to how we ought to conduct ourselves. But let me just say, and I feel very strongly about this, that the First Amendment to the United States Constitution means a whole lot to me. I'm sitting here as a result of a protest. We open up this meeting today, and many of you, Dr. Redfried most especially, and you, Mr. Ranking Member, talking about our great friend John Lewis, with whom I enjoyed a 60-year relationship. We met protesting, trying to get off the back of the bus, trying to integrate schools, trying to be able to shop in a 5 and 10 cent store and not be arrested for trespassing. Fine for us to get school supplies out of that store, but you can't sit down and eat a hamburger. I'm glad the government did not limit our protests. And so the First Amendment has constraints. The Supreme Court has told us that. You can't yell fire in a crowded theater, but you can peaceably assemble to redress your grievances. You can't do that. Well, I don't think any of those people who were marching out here on this plaza that's now called Black Lives Matter Plaza, they were not carrying guns. They were not disturbing anybody. They were peaceful. They were peaceful. When John Lewis went across that Edmund Pettus Bridge, nobody had any weapons. They were peaceful. They were met by weapons. And so I don't want us to get confused here. And so I'm going to close out my 5 minutes here by asking whether or not this disconnect that seems to be between what the White House is saying publicly and what they're sending out to the states privately. And as we mentioned earlier in the letter, several of these states seem to be reacting to the public statements from the White House and not following the recommendations of the task force that are being sent to them privately. Now, this week, A leaked White House coronavirus task force report paints a very different picture. I've got the document here. This was sent out to the states. And the states in the red zone that are refusing to comply is who heard from us. So I'm not being partisan here. We're trying to save lives. I started my professional career as a public school teacher. I have a daughter who spent 25 years in the classroom. And she's telling me every day how concerned teachers are about returning to school without the safety precautions that so many school districts have asked us to do. That is what my concern is. It's not about going back to school. I know the value of going to school. I know what it is to represent a school district where thousands and thousands of children do not have the internet and cannot receive online learning. I want them in the classroom. I want them to be educated, but I want them safe. And that's what this is about. And I'm not going to ask for an answer to that. I've gone over my time, but I'll yield back. I'll yield to the ranking member.
I thank the gentleman for yielding, and I'll start questions with where the gentleman from South Carolina ended, and that is with safely reopening schools. I first want to point out that this is a report from the United States Department of Treasury as of June 30th, based on the CARES Act and the $150 billion that we in Congress, working with President Trump, sent to the states for various COVID-19 recovery issues. Every state still has billions of dollars remaining in those accounts. And I would urge any school system, because we don't want any school system to open up without safety precautions. In fact, the American Academy of Pediatrics lays out really well how to safely reopen schools. The Centers for Disease Control lays out very clearly how to safely reopen schools, and that includes masks, sanitizers, other supplies. Any local school system that wants to claim they don't have the ability to do that, go straight to your governor. Your governor has billions of dollars in their account that we appropriated, sitting there waiting for you to buy supplies. It's fully eligible. We don't need to change a law. Billions of dollars. Every state has money for supplies. If you run out, give us a call, but right now there is money in your state's account to buy supplies, masks, sanitizers to safely reopen. But now let's talk about why it's so important to safely reopen. And I'll ask you, Dr. Redfield, because I know you've done a lot of work in this. We see, for example, the District of Columbia is currently saying that they're not going to reopen within school learning. There's not been a single death. Not a single death of anybody under the age of 19 in the District of Columbia. In fact, in Virginia, you're seeing Northern Virginia take this same closed-minded approach. Not a single death in the entire state of Virginia of a person under the age of 19 from COVID-19. But now let's talk about the danger, the detriment that this is doing to those children. I want to dig deeper into the studies I've seen on some of the things you talked about. Mental health, a lack of screening for child abuse. I've seen that maybe 14,000 cases of child abuse are reported in schools every year. That's not happening. And for those children that are in those home settings where the parents are abusing the children, nobody's getting reported because the children are sitting at home. They're not right now, in many of these cases, going to be allowed to go into the school where it can be detected, and it is detected every year. I know we don't talk about it a lot. It's an unfortunate part of our country's society, but it happens. Children are abused, and in so many cases, it's detected in the school. That's not going to happen if these schools don't open. Can you talk about those numbers? Have you seen some of that data?
Well, Congressman, I can just reemphasize what you said, and it's obviously one of the more disturbing consequences of the lack now of that reporting, not just at schools, which have been so responsible for mandatorily reporting child abuse, but the other place that sometimes it's recognized is obviously in the clinical setting. And as we know, pediatric visits have been curtailed in a lot of clinical settings. So, I mean, it is a highly significant situation now, and you can imagine what it must be like to be one of those recurrently abused children that has sort of lost their safety nets.
Well, and I apologize, we're running low on time. I would just urge any local school system that's making their decisions, go look at the CDC guidelines. Go look at all of the data that's out there for teachers, for students, how to safely reopen. You can do it. You owe it to those kids, 50,000 kids in the District of Columbia. Over 50 million children are counting on us to do this right. It can be done. You have to go do it. You owe it to those kids. They're being denied that opportunity. Don't deny them. If you need money, there's billions of dollars sitting out there for the supplies to keep the schools safe. Go make it happen. Dr. Fauci, I want to talk to you about Operation Warp Speed. And first, I want to thank you for, in your opening statement, talking about the over 250,000 people have signed up for those clinical trials. What's that website again if somebody in America wants to be a part of this trial?
coronavirustreatmentprevention.org.
Thank you. Now, to ask about, and I know a lot of people don't really know the details, and again, of all of these plans that are out there, these are plans. I know some people, including some people in this room, disagreed with President Trump's decision to stop flights from China, for example. As you testified earlier, it was the right decision, and it saved lives. I guess they were okay if more lives would have been lost, but that decision saved lives. It was part of a plan. They might not agree with the plan, but the plan saved lives. When we talk about warp speed, I do think it's real important to note, because some people are concerned that there might be some cutting of corners to get to a quicker vaccine. Clearly, that's not the case. But what President Trump really has done is removed red tape so that agencies like the FDA can laser focus on putting their efforts behind finding a vaccine. President Trump's worked, for example, to make sure that clinical trials can be run simultaneously on the most promising candidates, a very targeted plan to quickly find a vaccine that's safe. So if you want to talk about Operation Warp Speed, how safe it's been and how that is helping us to move forward, is red tape being removed by the plan that President Trump has?
Yes, it is, Congressman. In fact, as I mentioned, and I'll just reconfirm it right now, is that the speed is not at all at the compromising of safety nor of scientific integrity. Getting from the sequence to the vaccine production was record speed, had nothing to do with safety, had nothing to do with cutting corners. From the vaccine to the phase 1, again, was in record speed only because red tape was really avoided. And as we got into phase 3, the same thing.
And have you seen concerns about China trying to steal that information? I understand NIH has an investigation going on.
Yeah.
We've seen cases where China's trying to steal this information. Clearly, they're a threat that President Trump is taking on. What have you seen, and what is the threat?
I have heard that there's been trying to be hacking into the websites and the online components of certain of the people who are developing vaccines. I've just heard that. I have no proof of that.
Thank you, Mr. Chairman. I yield back.
Yeah.
I thank the gentleman for yielding back. The chair now recognizes for 5 minutes, Mr. Waters.
Thank you very much. Let me first say that I was pleased to hear the very, very warm comments about John Lewis this morning. We have been memorializing him in so many different ways. But, you know, between the press and everybody else, we've been doing him justice for the sacrifices that he has made. And let me just tell you, this virus is not Democrat or Republican. I'm going to send my condolences to the family of Herman Cain, who was a presidential candidate, who is a good friend of the president's, who happened to have been at the rally in Tulsa, June 20th, with no mask on, with a group of people around him with no mask on, and he's dead. He died. I'm told that he was in good health and that he, of course, contacted the virus as a result of his attendance and without a mask there. So my condolences to his family, because like I said, this is not Democrat or Republican. I just want to remind the committee that I spoke earlier about the manipulation of hospitalization data and what the president has done, basically ordering hospitals to change how they report hospitalization rates. And I drafted an amendment to HR 7617, one of the fiscal year 2021 appropriations packages that includes the Department of Health and Human Services. My amendment, which prohibits any funds from being used to require hospitals, hospital laboratories, and acute care facilities to report COVID-19 data under requirements imposed by the Trump administration's new rule was adopted. I look forward to preventing a harm that I believe will lead to senseless and avoidable suffering. Let me go further and say that I'm alarmed about the way that the president is handling so-called information about children and their ability to return to school. This is a president who first called the pandemic a hoax. This is a president who said it was going to just disappear. This is a president who said you don't really need masks. He didn't believe in them. He's gotten religion in the last few days. This is a president who disregarded social distancing. This is a president who recommended hydroxychloroquine as a cure. And this is a president who went so far as to say disinfectant could be used. And so now, this president who expects us to believe him rather than the medical experts is saying children are almost immune. Is that an expert medical conclusion, Dr. Fauci? That children, or whatever that means. What does that mean? Children are almost immune from this virus.
Well, generally, when you say a person is immune, that they're protected from getting infected. And children do get infected.
And so this is not an expert medical conclusion that we have had documented somewhere?
Well, I mean, if you're talking about a conclusion that children in general are immune, that children do get infected, we know that, so therefore they're not immune.
Okay.
I mean, what I must just say, Congresswoman, that when children get infected, that when you look at the deleterious consequences, they generally do much, much better, because if you look at the hospitalizations, that children have a much, much lower rate of hospitalizations than adults. In fact, the curve goes way up as you get older and older. And when you get to the age group of children, they generally do not get serious disease as much.
I understand that, and I've been listening, and I did understand what you just described. But what I was asking really was about this president's latest comment that children are almost immune. And so I think I got the answer to that. But let me just say to Mr. Scalise that this billions of dollars that you're talking about in every state, I don't know where they are, but you keep referring to supplies. It's more than about supplies. It's more than about being able to wash your hands. It's about space and whether or not all of the schools have the space to do the social distancing. It's about whether or not children are going to wear masks and how that's going to be enforced. It's about how you keep children from gathering. It's about how do you feed them. It is about more than the fact that they need some supplies.
Would the gentlelady yield?
Yes, I'll yield.
Clearly, that is all part of what is laid out in CDC guidelines in the Center, in the American Academy of Pediatrics guidelines. They lay out those guidelines for how to do all of those things.
Okay, reclaiming my time.
Usually about 10 feet away from a student.
Reclaiming my time. Let me just say this, that all of the professionals are saying that this is a decision that must be made by parents in the communities, with the educators, et cetera, et cetera. You cannot hand down an answer from the federal government that, you know, would absolutely protect these children. One decision by the federal government is not sufficient to force these schools to open. I yield back.
I thank you, gentlelady, for yielding back. Before I go to Mr. Jordan, let me say to Admiral Jawar, I understand you need to leave in 4 minutes. Would there be anything you'd like to enter into the record before leaving?
No, the reason I'm leaving is because we have a meeting virtually with all 6,100 of the Commissioned Corps officers, whom I have the honor to lead along with Surgeon General Adams. We've done over 7,200 deployments of 4,000 individuals. And let me tell you, the other 2,000 are hard at work taking care of people at qualified health centers of the Indian Health Service or in the prison. So I mean no disrespect by leaving, but this is a crunch time for our officers. on the front line of the pandemic, and I really appreciate the opportunity to recognize them and also to be with my brothers and sisters in uniform.
We thank you for your service, and we thank you so much for that. I think you might find me to be the biggest booster in the United States Congress for federally qualified community health centers. I consider them to be the ultimate safety net in health care. And I have been that way since I've been here in the Congress. I'll go back over 50 years with community health centers, and I believe in them, and thank you so much for bringing them into the process. And with that, I yield to Mr. Jordan, 5 minutes.
The right to protest is important, Mr. Chairman. I have engaged in it with fellow citizens, peacefully assembling to talk about important public policy issues. My guess is everyone on this committee, probably everyone in the United States Congress, has done the same thing. But I think all the First Amendment is important. Democrats seem to think it's just the right to protest. I think all of them. You think about the freedoms we have in the First Amendment: freedom of religion, freedom of the press, freedom to assembly, freedom to petition your government, freedom of speech. All of them are important. And what's interesting to me is the very first one the founders mentioned was your right to practice your faith. But government's putting all kinds of limits on Americans' ability to do that, and Democrats are just fine with it. In fact, Democrat mayors and governors have been sued over limiting people's right to freedom of religion. I want consistency. That's what I want. In fact, I'm concerned about the whole Constitution. Democrat mayors and governors have limited Americans' right to exercise their Second Amendment liberties, closing down stores that allow people to exercise and purchase firearms and exercise their Second Amendment liberties. I think it's important that Americans get an education, but we got Democrats who say can't go back to school. Kids can't go get what they need to put them on the path to achieving the American dream, but boy, they can protest. Everyone can protest. In Portland, in fact, the teachers union says, we don't want to go back to school, we don't want to teach kids, but they've actually encouraged teachers to go protest. The 9-week protest going on in Portland, where they burn the city every single night, where just last weekend 3 officers were blinded by the lasers that some of these peaceful protesters use. So I'm concerned about Americans, all rights, all the privileges. All kinds of Americans right now aren't permitted to go to work. Maybe it's a small business they started, put their entire life savings on the line, started this business, have a number of employees whose families are counting on them running their business. And what's government do? What do Democrat-led governments do? They arrest them if they want to run their business. Just ask Ian Smith and Frank Trombetta, who run a gym in New Jersey. So the ability to engage in your livelihood, the ability to have your kids get an education, the ability to practice your faith are just as important in my mind as protesting. I just wish the Democrats would look at all the rights we enjoy as Americans and make sure that they're dealt with in a consistent fashion. This idea that we're limiting what people can do, practice their faith, run their business, employ people, engage in their livelihood after they poured their entire lives, their families' resources into it is just wrong. You know who else has to go to work? You know what? You know who else has to go to work? Law enforcement has to go to work. Are you guys tracking what's happening to law enforcement at all at these protests? And I'm not talking about the 49 police officers who were attacked 2 weeks ago in Chicago. I'm not talking about the 3 who were blinded this past weekend in Portland. I'm not even talking about what the Seattle chief of police said when she said she can't deploy. She had to do an adjusted deployment for her police officers because the protests are so bad, and the defunding concept that is happening around our country in these in these cities. Chief Best said she had to do an adjusted deployment, told the citizens, we're not going to be there, you're on your own. But where they are out there, these police officers, are you guys tracking what's happening to them? Not talking about the violence, but the exposure they have to the coronavirus? Dr. Fauci?
I'm sorry, sir, what was the question?
Are you tracking what's happening to police officers and their exposure to the coronavirus while they're out doing their job?
I don't do tracking of the infection. That's probably more of a CDC question. I've not tracked.
Is that a concern? You talk about park police who've been under siege. You're talking about law enforcement in our municipalities that have been attacked. But I'm just talking about the exposure to the virus as well when people are yelling and screaming in their face. Are you concerned about that?
As I said before, I'm concerned about any crowds, particularly people who don't wear masks. I'm concerned more about indoor crowds than I am at outdoor crowds, but crowds without masks are a problem.
Dr. Redfield?
We continue to look at a variety of number of first responders in some of our surveys, looking at antibody to try to understand what the virus attack rate is. We do have that for some cities. I don't have it for the West Coast right now. But
So you do have that information on some law enforcement in some cities?
First responders, for example, we've done New York, we've done Detroit, we're doing Rhode Island right now.
Well, that'd be information that'd be helpful to this committee when I think about what our law enforcement is having to endure, particularly at these protests. Not just the violence, but the exposure now that they're getting to the virus from the protesters. And frankly, I wish we would get something from the other side. The silence on what's happening at these protests and the impact it's having on our law enforcement, I think, is just unfortunate. I hope they join us in speaking out against the defund the police concept and everything that's happening to law enforcement around the country.
The gentleman's time has expired, and as I yield to Ms. Maloney, I will say to the gentleman, I'm sure enough waiting on you to tell me the difference between a first responder and an essential worker. Just think about that for a moment. With that, I'll yield back. I'll yield 5 minutes to Ms. Maloney.
I thank the chairman and the ranking member for this incredibly important hearing and for all of our participants, our witnesses. I have 2 questions that I think are especially relevant that have not been discussed very much. And one is, what is the task force doing in relation to safeguarding elections? We are going to be all voting in November. Some states have vote by mail, other states do not. And many people prefer to vote in person. And we have guidelines that say social distancing of 6 feet, but possibly could it be changed to 3 feet if it's going to be more of a hurried participation. But I think it would be helpful to the American public if the task force considered and came out with clear guidelines for the professionals working in the Board of Elections across the country and the people participating in voting. So I'm making that request. You may want to comment on it now, Dr. Fauci, or get back to us.
I'd be happy to get back to you on that. We could discuss this at a task force meeting if you'd like and get back to you, Congressman Maloney.
And to the public, I would say.
Yes.
And Congresswoman, if I could just comment, CDC did in March and updated in June guidelines for polling facilities, and we'll obviously be looking at that to see if they need to be updated more. We do have an MMWR coming out this week looking at the primary results in Wisconsin. So this is an area we're trying to make sure the polling centers and people who go to polling centers to vote understand the importance of the guidance we can give.
That would be very, very helpful. Secondly, as a former teacher, I'm concerned about the contradiction in messaging. You know, as a teacher, we're taught to get your facts straight and then communicate it very simply and directly. So the task force will come out with very important, relevant information, and I try to follow it all religiously. But then it's countered by other leaders. And this, I think, underscores or undermines the ability of the public to respond. And maybe you could get back to me on that. But I also want to talk about something that I think is very important that people are really not discussing. And that is the turnaround time on testing. And in New York, we are working very hard, not only in supplying the tests, but we're also trying to trace and isolate. And the professionals working in this area say they have to wait so long, especially if it's a private test, like from Quest or something. The turnaround time is like a week or 16 days in some cases. So then they can't really trace, because by the time they get the results of the test to start tracing and isolating, it's too late. So I'd like both of you to comment on it. This is something that my city's working very, very hard to respond professionally to everything you're recommending, but they tell me they're having a terrible time trying to implement the tracing and the isolation, and they nail it on the turnaround time from the test is too slow.
Well, thank you for the question, Congressman Maloney. Admiral Giroir had actually addressed that, but maybe I could just summarize what he had said both in his opening statement and upon response to a question. There's no doubt, and I've said that myself, if you have to wait multiple days for the result of a test, and the test is done in the context of contact tracing, that it in many respects obviates the whole purpose of doing it, because if you have to wait that long, a person has already been out in the community for that period of time. One of the ways to kind of prevent that and mitigate that a bit is that if a person goes in for a test, they should assume that it might be positive and should essentially isolate themselves before they go back until they get the result of the test. But in response to that, as Admiral Giroir had said, the reason for that is that there's such a surge of demand for tests that they're trying to overcome that by trying to separate the testing for surveillance and give it, for example, to one group and let the testing that has to do to determine if an individual is infected to be able to cut that down. He explained that, but as I said, he's much more capable of giving us the precise numbers. But it is an issue if you can't get it within a 24 to 48-hour period. Bob?
Thank you. I yield back.
Thank you, General Leader, for yielding back. The chair now recognizes Mr. Luke DeMaio for 5 minutes.
Thank you, Mr. Chairman. One of the words I use to try and discuss this issue, the COVID problem with people, is always perspective. Try and keep in perspective the disease, the solutions, the other things that are out there. And this is why I asked a question a while ago with regards to attention on COVID and the seeming lack of that for a while on the rest of our healthcare needs. Another situation that I think is concerning is, as we open up our schools, one of the things that's, we look at the damage and concern we have for the children's health care, but yet I did a little research on football injuries. We're almost in the same neighborhood with the deaths, not taking into account the other severe and lifetime injuries that are sustained by young men playing football in high school versus the total deaths that would be anticipated from reopening our schools. And I don't see here an outcry about that. So perspective, to me, is something we always need to consider. One of the things that concerns me also is I wish that Admiral Giroir was here yet. I asked this question of him last time he was here, and we didn't have enough time to continue our discussion on it with regards to the sort of perverse incentive for the medical folks to claim that somebody died of COVID versus if it's an automobile accident, for instance, as long as you have COVID in your system, you get to claim it as a COVID death, in which means you get to get more money as the attending physician, hospital, whatever. And he acknowledged that the statistics he's getting from the states are overinflated. We found that the governor of Colorado, who is a Democrat, actually did a research on this and found he had to get rid of 12% of the deaths that were recorded in state. Dr. Redfield, would you like to comment on that a little bit about the perverse incentive, and is there an effort to try and do something different in a way that these deaths are recorded so we actually have better records and better numbers, better data to go with?
Thank you, Congressman. I think you're correct in that we've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement. So I do think there's some reality to that. When it comes to death reporting, though, I mean, ultimately, it's how the physician defines it in the death certificate. In our National Health Statistics group here in Hyattsville, we review all those death certificates. So I think it's probably less operable in the cause of death, although I won't say there are not some cases. I do think, though, when it comes to hospital reimbursement issues for individuals that get discharged, there could be some play in that for sure.
Well, the Admiral certainly acknowledged that last time he was here, so I think that's very concerning. Dr. Fauci, one of the things you made a comment a while ago with regards to hydroxychloroquine, and I have an article here that quotes the Henry Ford Health System an extensive study on hydroxychloroquine, and they say that it significantly reduces the death rate of COVID patients. The study was highly analyzed by peer-reviewed, unlike many other studies, and quoting the executive officer said, as doctors and scientists, we look at the data for insight, and the data here is clear. There was a benefit to using the drug as a treatment for sick and hospitalized patients. And in talking with a lot of older doctors who have been around a while, and I trust their judgment and their use of hydroxychloroquine, they say that the initial studies didn't really use zinc with it, and they say that zinc is an enabler to be able to help hydroxychloroquine actually do its job of going after and reducing deaths in patients. Had a long conversation with a doctor earlier in the week, and he said, yes, as long as zinc is there, it really definitely does work. Without it, it's minimally effective. Would you like to comment on that?
Thank you for that opportunity to comment. The Henry Ford Hospital study that was published was a non-controlled retrospective cohort study that was confounded by a number of issues, including the fact that many of the people who were receiving hydroxychloroquine were also receiving corticosteroids, which we know from another study gives a clear benefit in reducing deaths with advanced disease. So that study is a flawed study, and I think anyone who examines it carefully is that it is not a randomized placebo-controlled trial.
It says it's peer-reviewed.
It doesn't matter. You can peer review something that's a bad study, but the fact is it is not a randomized placebo-controlled trial. The point that I think is important, because we all want to keep an open mind, any and all of the randomized placebo-controlled trials, which is the gold standard of determining if something is effective, none of them had shown any efficacy for hydroxychloroquine. Having said that, I will state, when I do see a randomized placebo-controlled trial that looks at any aspect of hydroxychloroquine, either early study, middle study, or late, if that randomized placebo-controlled trial shows efficacy, I would be the first one to admit it and to promote it. But I have not seen yet a randomized placebo-controlled trial that's done that, and in fact, every randomized placebo-controlled trial that has looked at it has shown no efficacy. So I just have to go with the data. I don't have any horse in the game one way or the other. I just look at the data.
Thank you very much.
The gentleman's time has expired. The chair now recognizes for 5 minutes Ms. Velasquez. You want to yield to Kim? Mr. Kim is now recognized for 5 minutes.
Thank you. I just wanted to start here, picking up where I left off. I started my last question line asking each of you if our federal government was doing everything possible to be able to respond, and each of you said within the capabilities of our government that we were. The reason why I wanted to address this is when we talk about a national testing strategy or greater coordination on personal protective equipment, what I've heard over and over again is that, that it's about where the responsibility is. Is this the responsibility of the federal government or the responsibility of states or localities? And when I talk to the people in my district, what they want to know is about capabilities. And they really don't want to just see this kind of blame game between different parts of our government. And the main thing they want to ask is, are we doing everything humanly possible to be able to address this crisis? And is every level of government, including the federal government, doing everything that they can to do this? And if we are not, the American people deserve to know why. So, Dr. Fauci, I wanted to go back to you here, because just to be clear, when I asked you this, and you said that within the capabilities that we were, I want to ask you, would you say that our response at the federal level to this crisis, would this be considered in your mind, drawing on all your expertise, is this the gold standard of responses that our federal government can do? Is there nothing else that you can think of from your expertise and experience that we could be doing or should be doing that we're not already doing?
I think I just have to repeat what several of us said, that within the context of what we have, what's available to us, we're doing everything that we possibly can. And I'll just repeat what I said. Clearly, the thing that I am responsible for, we are doing everything that we possibly can. Absolutely.
And within what you see with your position on the task force, for instance, Are you confident in the level in which we're using the Defense Production Act to be able to bolster production?
You know, that's something that's really out of my realm, Congressman, about the extent and the implications of the Defense Production Act.
What about when it comes to, we have these we had federally backed test sites that we had stood up at 41 across the country, but they've been handed over to states. Are you confident that that was the right move, that we shouldn't be standing up more federally backed test sites that are run by the federal government right now?
I'm sorry,
The federally backed test sites that we had stood up, 41 of them across this country, we've been handing them over to the states instead of continuing this in the federal government's control. Do you feel like that's the right decision?
I don't think I could give a really good answer to that because that's not something that I get involved with. So I don't know, maybe Bob, you have any further information about federally funded testing sites, because that's out of the purview of what I do.
Dr. Redfield, do you have any thoughts on this?
Well, I think it was important to, as the chairman alluded to begin to enhance and transfer this capacity to these federally funded health clinics and to increase that capability. It is a partnership, so I think that these were appropriate moves. I do think when you ask, are we doing everything that we could do? There's two things I'd like to say. One is, don't miss this opportunity to realize how important it is to make the investment in the core capabilities of public health for the future. Because clearly, we were handicapped when this outbreak started, and we don't need to have that happen again. Secondly, I don't underestimate who ultimately is the most important in helping us beat this pandemic, and that's the American public themselves.
I get that, but I find that to be a frustrating narrative too, because certainly all individuals have to take on some responsibilities to be able to do this, but that feels like we're pushing it off to them. And it feels like that the responsibility is now being pushed to the American people coming out from that. And for instance, as you know, Congress, we passed legislation back in April that includes $25 billion in additional funding for testing and tracing. I'm still hearing that a lot of that hasn't been used. So I wanted to ask you if you have knowledge of how much of money hasn't been spent on this, and whether or not the OMB or any other part of the government is holding up access to be able to do that, so we have the capabilities and the resources to be able to continue to increase our capabilities.
Yeah, Congressman, of that money, of that $25 billion, which is a significant amount of money, $10.25 billion came to CDC. And we got that money out to the states, tribes, local and county health departments literally within 2, 3, 4 weeks, and that's been all distributed.
One last question here, Dr. Fauci. Do you have thoughts on using rapid antigen testing or paper strip testing, things like that could create more point-of-care response?
Yeah, I can answer that one. Sure, anything that gets us a quicker, more rapid, more scale-up capability of testing is something that would be desirable. And in fact, that was one of the things I mentioned very quickly in the third component of the NIH strategic plan, the RADx, which is about $500 million, to try and develop exactly the kinds of tests that you're talking about. Rapid, point of care, highly sensitive, highly specific.
Well, let's try to work on that together.
The gentleman's time has expired. Ms. Vorlosky, you're recognized for 5 minutes.
Thank you, Madam Chair. Thank you, Dr. Fauci, for hanging out with us. Really appreciate it. I think the one question that I have left today, and I think it's a question the American people want to know, my district certainly wants to know, in Indiana, is it your opinion, do you believe that China covered up the origins of the crisis? You are in this closer than anybody else in our country, and the American people listen to what you have to say. I've been asking lots of questions since this committee was created, because I think China needs to be held to a much higher standard than we're holding them. But do you believe China covered up the origins of the crisis?
You know, Congresswoman, it really depends on what you mean, origin of the crisis.
The beginning of the pandemic, the disease itself, as it broke on TV and we saw it.
Well, I think from what we know, and I'm sure Bob can also comment on that, from the conversations that we had early on, it was led to believe that early on that this was jumping from an animal to a human in the context of the wet market in Wuhan, and that it was inefficient virus that just jumped from an animal to a human and didn't necessarily spread very well from human to human, at a time when it was clear that there was at least a few weeks and maybe more of transmission from human to human that we didn't know about. And then when we finally found out that it was a highly efficient transmitter from human to human, it would have been nice to know about that sooner.
So, all right, do you think China is a threat to the American vaccine research that we've been talking about for the past 3 hours?
Did China do what with the vaccine?
Do you believe that China is still a threat today to the American vaccine research after
No, I don't think so at all. I think one of the things people need to understand that what we do is really transparent. We publish it, we announce it. So if they want to hack into a computer and find out what the results of a vaccine trial are, they're going to hear about it in the New England Journal of Medicine in a few days anyway.
So, you know, when I testified earlier, I was talking about the fact that just a few days ago that our country indicted by the Justice Department 2 Chinese nationals for hacking the heroes that are working on a vaccine. China has obstructed every single thing that we've done, turn that we've made, place that we go, starting all the way back with PPE. And I was very involved in my district in trying to get PPE, and China was obstructing every single part of the way. So I think, you know, my fellow folks in my district and in this country believe otherwise. I think, you know, the American people want to make sure when we're talking about safe vaccines and we're talking about the FDA and we're not shortcutting safety and those kinds of things, I don't know how in the world that we can stand there and say, no, I don't think China's a threat to the vaccine production in this country when we just indicted 2 people, and not just 2, but I think that question is so important, Madam Chairwoman. I think it's so important. I want to re-ask my question. I see our chairman's not here, but to you, Madam Chairwoman, we need to investigate that answer on cybersecurity. You know, we've already indicted more than 2 people, but just 2 people in the last couple of days ago. Why can't we have a hearing in here? And I understand the chairman has said before, well, there's other committees having hearings on the role of China, but nobody's having a hearing on the role of China versus the producers in America and the vaccine process that we're looking for, the heroes that are trying to save lives. That would be appropriate for this committee. Can we get a commitment? Can I get a commitment from you sitting in for the chairman that we will actually have a hearing and look at this?
This committee is chaired by Mr. Clyburn.
Right now it's chaired by you, Madam.
I do not intend to give you an answer to a question about how to run this committee in his absence. You may address him when he returns, not me.
I appreciate that answer, and I will, but I think for the record, I think we still are owed an answer as to why we can't look at that in this committee. There's no other committee set up to look at the vaccine process of oversight than this one, especially having you gentlemen here today. So I would yield back my time and add that for the record. Thank you, Dr. Fauci.
Who do we have next coming up? Mr. Foster, you are now recognized for 5 minutes.
Oh, thank you, Madam Chair, and to our witnesses. Well, first off, I'd like to second the comments of my colleague, Representative Dr. Mark Green, on the letter that was recently sent from this committee providing for ongoing real-time bipartisan oversight of Operation Warp Speed by the Government Accountability Office, the GAO. With Dr. Green and myself as the bipartisan points of contact, directing the GAO of points of interest to the committee. You know, in my time in science, I was involved in billion-dollar research projects that were subject to GAO oversight. They would bring in outside experts, they'd ask hard questions, and they report back to Congress the truth as they see it. You know, both from a technical and scientific point of view and also a project management point of view, which can often be critical. GAO is fastidiously nonpartisan. They will give us real-time briefings, staff briefings and member briefings, and periodic reports on the progress of vaccine and therapeutic manufacturing under Operation Warp Speed. But they will only give us briefings on a bipartisan basis, which I think is very valuable, because it will be crucial that people believe when vaccines and therapeutics become available that the process was not politicized, that we actually have bipartisan agreement that reasonable decisions, free of conflicts of interest or political intrusion, are being made. And the GAO is intent on not becoming a tool for partisan advantage, which really helps our government work better. So an example of the sort of thing that I'm interested in having them look into is something I was discussing with Dr. Redfield over the break, which is a monoclonal antibody therapeutic manufacturing. You know, there's a lot of the good news is that there is, in fact, a strong immune response to this virus by the human immune system. This means, among other things, that vaccines are more likely than not to work, and it also means that antibody therapeutics are more likely than not to work, as they have against recent viruses. So we may be in this position where, yeah, there's a miracle cure that can then prevent or cure COVID-19, but we do not have the manufacturing to meet the demand, especially given the ongoing flare-up of COVID-19 in our country. And so that you can imagine the politics of that will become extremely fraught rapidly when we have to decide how to dispense this potentially life-saving therapeutics. And so it's also a circumstance in which aggressive project management may be crucial. You know, you can imagine if you want to produce the maximum number of antibodies, you may say, okay, we are going to choose the most effective antibody from company A. We are going to produce it using the optimized cell lines from company B, and we're going to use the high-volume production equipment on company C. This will require things like the Defense Production Act being used at their fullest to just leapfrog around issues of things like intellectual property. You know, already the companies that are optimizing cell lines are getting into patent fights and so on. We don't have time for that. And so one of the things I'd like the GAO to look into is to make sure that we have in advance the sort of project management, you know, that the contracts that are being made with all of these companies anticipate this, or that discussions for the applications of the Defense Production Act, you know, are actually taking place ahead of when they'll be needed. It's just one of many examples there. And so I just want to encourage, you know, both of you and HHS generally to greet with open arms the GAO oversight. They can, you know, it's not always fun being subject to GAO oversight, but their questions actually make the projects better. And so also, I think you've probably been involved with projects that have been involved with GAO oversight, and so there's a career-long association of the GAO personnel and the agencies they represent, and so that, you know, it's not like you're getting a letter from Congress where you just kind of roll your eyes and try to do the minimum. You know, these are serious questions by professionals. So when Dr. Green and I intend to use that to provide real bipartisan information to this committee and to Congress and to the American people about what's really happening, and I think that will be crucial. So any of you, and do you have any comments on other things that we can do to really make the public confident that the right decisions are being made for the right reasons in this?
Well, thank you for that, Congressman Foster. Yes, I mean, the fact is that we are very transparent in what goes on in Operation Warp Speed. I have been...
Well, but there have been public comments by the scientists, the active collaboration, which was set up by HHS. Some of the scientists involved in that said, I have no idea what's behind one of the Operation Warp Speed decisions.
Right. So in direct answer to your question, I think you brought up a good point about the monoclonal antibodies. We didn't get an opportunity to mention this in any of the questions, but monoclonal antibodies, just this week, there were 2 trials that have been initiated, one on an outpatient basis for early patients, one on an inpatient for more advanced patients, which we really have a lot of anticipation that is going to be something that is going to be an important tool in the armamentarium of how we treat COVID-19 patients. So I wanted to get that in because I think that's really important. Regarding the scrutiny of a GAO or otherwise, I have been, in the many years that I've been doing this, had many GAO looking into the things I've done. In fact, I have found it in many respects very helpful.
Thank you. Yield back.
Gentleman's time has expired. Ms. Velasquez, you are recognized for 5 minutes.
Thank you, Chairwoman. I want to get back to the delays in testing. Researchers at the University of Pennsylvania recently found that testing sites serving communities of color in big cities are fewer in number, have longer lines, and often run out of tests faster when compared to sites in wider areas in those same cities. As former Federal Reserve chairs Ben Bernanke and Janet Yellen told the Select Committee, nothing is more important for restoring economic growth than improving public health. Yet, we have the president that says slow down testing, please. And the most vulnerable among us are being impacted. Frontline workers, small businesses that cannot reopen safely, and Black and Latino populations. So I have some questions along these lines. Dr. Fauci, I have a simple question for you. Do you attribute this inability to control the virus to the delays in testing and contact tracing?
Thank you. Control of the virus is clearly a multifaceted process that involves many things, the most important of which is what we were just speaking about before, about testing, about masks, crowds, outdoor versus indoor, distances, et cetera, et cetera. We've been through that multiple times during this hearing. Testing is a part of the process, but the process of controlling infection, when you're talking about contact tracing, obviously you need testing, and you need testing back within a reasonable period of time. And the concern that you're expressing is for the days that it takes, and Admiral Giroir has addressed that several times during this hearing. But testing is a part of the comprehensive approach, not the only thing, but as part of the approach.
Thank you. South Korea had rapid results for testing and tracing, and the virus is essentially contained there or gone. Do you agree that what they did with respect to testing helped those countries get the virus under control?
Virus and the control of some of the Asian countries were due to a number of factors. Their ability to shut down almost completely, as I mentioned in a remark before, to the tune of 90+%.
Did they rush to reopen the economy?
No, they shut down. They had the capability, because they got down to a very low baseline, to do adequate identification, isolation, and contact tracing. Right now, they are trying to reopen. It's going to remain to be seen how successfully they do that.
So, for the record, does testing result in the U.S. seeing more COVID cases, or are other factors causing the spread? Does testing result in the U.S. seeing more COVID cases, or are other factors causing the spread? Okay. So, are we seeing more COVID-19 cases in the U.S. because of the testing results?
Obviously, if you do more testing, you're going to see more cases.
Okay.
But the increases that we're seeing are real increasing in cases, as also reflected by increasing in hospitalization and increasing in deaths.
Why is that professional sport leagues can get testing turnaround times within 24 hours, but we cannot do it for all Americans?
Well, some of the sports clubs have been using the rapid test, which is really very different from the test that requires extraction of DNA and takes time in a different machine. So they have bought a bunch of machines that allow testing to take place where you get a positive back in 5 minutes and you could declare negative in 15 minutes.
Dr. Redfield, do you support the fact, do you agree with the fact that there is a disproportionate testing going on among Latinos, Black, Native Americans?
I wish the Admiral was here to answer it, but I've heard him answer this before, and Tony may comment, that he has set up disproportionately these testing sites in areas that have indications of more complex social economic status. I don't remember the exact number, maybe Tony does, but more than 70% intentionally trying to target areas that may be more disadvantaged. So I wouldn't agree with that statement, but I would like the Admiral to be able to get back you with the specifics.
So you have seen the long lines in the urban cities and also in states where we have large population of Latinos and Blacks?
I've seen the television lines. What I was trying to say when you said, was it specifically disproportionate for Hispanic, Latino, or African American or Native Americans? And I'm not comfortable supporting that comment. I would rather get the specific data from the Admiral, which I do think the system has really gone over the other way to try to make sure we've enhanced the community health centers and these federally assisted testing sites in areas that are specifically more disadvantaged.
The gentleman's time has expired. The chair yields 5 minutes to Mr. Raskin.
Thank you very much, Mr. Chairman. And if you're trying to still figure out why the administration and our Republican colleagues cannot formulate a plan of action, look no further than the disgraceful diversions and distractions of some of our colleagues today. I want to address the First Amendment line of questioning first. Our distinguished colleague from Ohio keeps raising, for some reason, the Supreme Court decision in South Bay United Pentecostal Church versus Newton, which rejected his position just about 6 weeks ago in a 5-4 decision. A church said that the restrictions limiting the number of people who could go to church to 100 were perfectly constitutional because that was the exact same rule that applied to lectures, concerts, movies, spectator sports, theatrical performances, political party gatherings, and so on. In other words, there was no religious discrimination taking place, which is why the Supreme Court rejected the claim, and there is no religious free exercise exemption to public health orders, as you were indicating, I think, Dr. Fauci. So the parties in the case cited numerous cases of church gatherings with people unmasked, singing, chanting, and so on, that became super spreader events. There is no religious immunity to this disease, and there is no free exercise exemption to universal public health orders. Now, as for protest, let us not confuse the issue. Whether your protest is a right-wing protest, like Boogaloo and Proud Boys and anti-public health order protesters, like the ones who threatened the life of Governor Whitmer and tried to shut down the Michigan legislature and succeeded in doing so, or it's the nonviolent assemblies of millions of people with Black Lives Matter across the country, the kind endorsed by our late beloved colleague John Lewis, the champion of nonviolence, the same rules must apply. If a jurisdiction has a 6-foot rule and a masking rule, which I assume and hope every one of them does, it applies equally to everybody. And the preliminary results suggest, and I know because I've been to a lot of the Black Lives Matter protests, is people are not getting infected there as much because they are observing those rules. Obviously, when you go to an anti-public health order, anti-masking protest, like the kinds that shut down the legislature in Michigan, most people are not wearing masks and are not observing the public health protocols they've come to try to destroy. So if you're really concerned about the protests and people getting sick there, and we should be, then we have to look at the use of tear gas and pepper spray. Everybody saw the secret federal officers who were assembled by Attorney General Barr in Oregon remove the mask of a naval veteran and spray pepper spray right in his face. That's extremely dangerous to remove someone's mask and then to have them sneezing and coughing and so on. So it's the use of those chemical irritants, I think, which is the real danger. But Admiral Giroir, what I wanted to ask you was about the role that Jared Kushner has played in developing the administration's approach to, is he still with us, or is he, oh, he's gone now, okay. Well, Dr. Fauci, let me turn to you then. Are you aware of the role that Jared Kushner has played in developing the administration's approach to diagnostic testing?
I have no knowledge of that, Congressman, because I've not been involved in that. It's barely been Admiral Giroir being involved in that.
Okay. Well, then I'm sorry I missed Mr. Giroir in the second round, but yesterday Vanity Fair reported something astonishing, which is that Jared Kushner recognized that there was no plan, and he formed a secret working group at the White House in March and April to develop a national testing plan, which operated in a, quote, bubble and did not coordinate with other experts at HHS. And they actually came up with a very detailed and potentially effective national testing plan. One person involved said it wasn't rocket science, but it was a real plan in which the government would coordinate the distribution of test kits in an aggressive program of contact tracing across the country. But the White House reportedly dropped the plan, according to this article, how Jared Kushner's secret testing plan went poof into thin air, okay? The White House dropped the plan on the political logic that the outbreak was going to be limited to Democratic states. This is back in March in New York and New Jersey. And you remember there was a lot of talk about how this was a blue state disease, and there was somehow some kind of political or ideological immunity to getting it. So they thought it would be a better strategy just to pit the states against each other in that vicious free-for-all for equipment and materials, and then blame the governors when everything went wrong. And we've seen the shocking, devastating results of just letting it go and not having a plan at all. With that, I yield back to you, Mr. Chairman.
I thank the gentleman for yielding back. I think we've finished our second round of questions. And I would like to now yield to the ranking member for any closing statement he might want to make.
Thank you, Mr. Chairman. And again, I want to thank our witnesses for coming here, including Dr. Giroir, Dr. Fauci, Dr. Redfield. You're on the front lines, as well as the teams that are behind you working to implement President Trump's plan to combat this virus. In fact, Dr. Giroir left to go address thousands of people who work under him. He talked about 7,000 deployments that have been made under President Trump's command to have men and women in uniform going on the front lines to help at the state and local level. We've seen so much work being done in this plan, and I keep going back to it because I know some people want to deny that this plan exists. Of course, at the same time that they're criticizing components of the plan. You know, part of this plan, again, there's thousands more pages online. This is just a small part of President Trump's plan to combat the coronavirus. Part of the plan included stopping flights to China, which, as Dr. Fauci testified under oath, saved lives. That was President Trump's call. He got criticized from it. In fact, he got criticized from some of the very people who say that he doesn't have a plan, yet they criticize parts of his plan, and that plan worked and saved lives. I know, Dr. Fauci, you testified under oath about some of the other decisions that were made by President Trump, working in conjunction with you and the rest of the team, these respected, internationally respected medical doctors that saved lives. Thank God President Trump keeps his focus on carrying out this plan every day while people are literally trying to disagree with it and then deny it exists at the same time. And so when you look at now where we are with Operation Warp Speed, and this is something that is so incredibly important, working to find an actual vaccine for the disease. And again, Dr. Fauci, I know Dr. Redfield, you talked about this, but I appreciate you giving out the website. Again, over 250,000 Americans have now signed up to be tested for this virus. Might be one of the most tested trials for a new virus in American history. Probably the quickest time that we've been able to get a vaccine for a disease we knew nothing about even 6 months ago because China lied to us, because China still to this day is trying to interfere with our ability. While we're working feverishly to get the vaccine, China's working feverishly to try to steal the vaccine. We ought to have a hearing on that, Mr. Chairman. I know Ms. Walorski talked about that and brought that issue up. You know, when you look at the incredible work, as Dr. Giroir is doing on testing, to get those testing kits into nursing homes, that's part of President Trump's plan, and in fact, it is saving lives. If those 5 governors who did not follow the federal guidelines would have followed the federal guidelines, again, as testimony under oath confirmed, thousands of deaths would not have happened. I wish they would have followed the guidelines. I wish they'd share the data. They're still hiding the data, those 5 governors. We've asked them. Those of us on the Republican side, if just one member on the Democrat side, Mr. Chairman, would join us in asking those governors to share the data that they're hiding from the American people, they're hiding from the families, the sons, the daughters, the grandchildren of those who died in those nursing homes. They're hiding that data, and they won't give it to us. They said they don't have to give it to us because not a majority of this committee has asked. I wish, Mr. Chairman, you'd join us in asking to get that data. What's wrong with asking for the facts? And so then you look at opening schools. You want to talk about saving lives, and this is one of those untold stories, unfortunately. There are 50 million plus children across America who are counting on us to get it right. The good news is the Trump administration has laid out a plan for how to reopen schools safely. You know, just right here, you talk about school administrators on the use of cloth face coverings. CDC suggests that all school reopening plans address adhering to behaviors that prevent the spread of COVID-19. They go into detail on all the things you should do, as we talked about, washing hands, all of that. You can socially distance. You need a socially distance. You can do it. In fact, you need to do it. But to say you can't do it is a cop-out. This is America, for goodness sake. We put a man on the moon. You can follow basic guidelines. If you don't want to trust CDC, go to the American Academy of Pediatrics, for goodness sake, who put out really good guidelines for how to safely reopen schools. And they went further and said the danger to children. You're hurting kids by not reopening schools. As Dr. Redfield testified, the thousands of kids that aren't getting diagnosed with things like child abuse, which is happening, unfortunately, it gets discovered in the schools. That's not happening. The nutrition programs, the mental health programs, there are drug overdoses happening today that wouldn't be happening if those kids were going back to school. You have to get it done, and don't say it's because of money. You can't say it's because of money. Every state in the nation's got money. We put over $150 billion out there. Do you know that, based on this list, about $100 billion of money we in Congress appropriated, President Trump signed into law, about $100 billion still available in every state, and this money, without changing law, can be used to provide all of those supplies that the experts said you need to reopen your school safely. It's all there for you. If you run out, give us a call, but the money is there. Don't use that as an excuse. We all owe it to the kids. If there's never been a better time to make the argument for school choice, for goodness sake, you've got some of these unions that are saying they don't want to go back to school. As Mr. Jordan pointed out, they're encouraging people to go to a protest where you're not socially distanced, but they say you shouldn't be able to safely reopen the school, but they want to take the money. How about if there's another school system that's willing to safely educate your child? Shouldn't the parent be able to do that? Why deny parents in low-income communities the ability to have the same choice that other people that aren't in low-income communities have? That ought to be on the table, too, because there are systems all across this nation that have figured it out. Again, you don't need to reinvent the wheel. It's all there in the president's plan. President Trump has laid this out. You can go to the websites to get it. Come call me. I'll give it to you. But it's there. If you don't like it, you put a better plan on the table. Of course, they haven't done that. But in the meantime, don't deny those children the opportunity to seek the American dream that everybody else has deserved over the history of our country. And that's what will happen if they don't follow those safety guidelines and safely reopen the schools. So with that, Mr. Chairman, I again thank the witnesses, appreciate the work you're doing. Wish we could follow up on some of the other issues like Mr. Jordan, police officers that are being attacked right now and being put at risk to coronavirus. We had a hearing in this committee on our frontline healthcare workers, and it was an important hearing. I'd like to see us have a hearing on those law enforcement officers who are being put at risk by the attacks on them that we're seeing all across the country. And then, of course, China, the role that China has played from the beginning, lying to us, hiding information, now trying to steal our information every step of the way. We ought to have a hearing to hold China accountable too. So appreciate the work you're doing. Please continue to go do that. Tell all the men and women that are sacrificing to help combat this virus, working with President Trump. We thank them on behalf of all Americans who want to see us get beyond this and get back to the things that we used to do. With that, Mr. Chairman, I yield back.
I thank the ranking member for his closing statement, for yielding back the time. Let me begin by reminding him that we did have a hearing for essential workers. If my memory serves, police officers, law enforcement officers were included. They are essential workers.
In relation to the attacks we've seen on them, that's a new development since that hearing.
Well, I suspect that the protesters that my friend Mr. Jordan seemed to be so preoccupied with have had some state-sponsored attacks made on them, much like those that we remember from a not-too-distant past. But this week, a leaked White House coronavirus task force report indicates that there are 21 states in the so-called red zone. And for some strange reason, the report says that they were communicated with privately, and I'm kind of troubled that the administration would hide this from us. And so I don't know that this is not for question, but I'm going to ask Dr. Redfield if he would respond to us in writing on this, because I would like to know whether or not we can depend upon, going forward, these kinds of reports to be made public rather than be issued to these states privately, because it seems to us that while the White House is maintaining a public statement as it relates to this virus, they have been sending some stuff to states privately. And I would hope that this could come to an end. Now, I would also like to say to my friend who seemed to be so concerned about kids going back to school, Mr. Ranking Member, we all want to see our kids go back to school. I'm the grandfather of 2 school children that I want to see in school, though they are privileged enough to have the internet available to them. Their classmates, many of their classmates don't, and therefore many of their classmates are not going to be allowed to go to the next grade. Those same classmates are going to be subject to losing another year of school. We all want them back in school, but I want to refer, since we are talking about the American Academy of Pediatrics, they have followed up with us, the American Federation of Teachers, the National Education Association, School Superintendents Association, and they all joined together in issuing a statement on July 10th. And to me, here's what is operative. Public health agencies must make recommendations based on evidence, not politics. We should leave it to health experts to tell us when the time is best to open up school buildings and listen to educators and administrators to shape how we do it. I represent a congressional district that is about half and half what we might call rural and urban, though even the urban part of my district will be looked upon as being rural by some of my friends here on this panel from New York and California. So maybe I just do have a rural district. All I want to say is it's different in rural America than it is in urban America. So I don't know that we can up here come up with a one-size-fits-all. We should delegate to the professional superintendents and the principals of these schools to determine how best to reopen schools. We want them to reopen and arm them with all the resources they need to do that. So this whole notion of just telling people to go back to school, that is one thing. Give the principals, to the superintendents, the states, give them the resources they need and the guidance they need, and let them work with those rural communities that are different from urban communities, where they don't have the internet available to them and they can't do online learning. And they've got to be able to space. They've got to have masks. I represent families that cannot afford to buy a mask every day. Many of them can't afford to buy the books. So we ought not be putting that burden on them. And so we have resources up here that we ought to get out to these school districts. And I know, I hear from teachers every day who go in their own pockets to pay for material for their students. That's happening every day. And they're preparing to go back to school with budgeting to do the same thing. Now, before we close, I want to enter into the record. I have another letter from the American Association of Medical Colleges. And now I'm asking unanimous consent that this letter be entered into the official hearing, and without any objections so ordered. Now, I want to thank Dr. Fauci, Dr. Redfield, and Admiral Jawal for being here today. We appreciate the expertise you have shared as we work to end this terrible pandemic. As we heard today, a comprehensive plan to reduce the spread of the coronavirus would save lives. But everyday effective action is not taken, more lives are lost. Today's hearing has made clear that the Trump administration must put aside partisan concerns and work with public health and medical science experts to craft a comprehensive plan to defeat this virus. The plan must prioritize public health over perceived political expediency. The plan must ensure states have the testing they need, give Americans clear public health advice, and follow the advice of legitimate experts like we have here today, even if their assessments are difficult for administration officials to hear. Much of this is inconvenience to the public. Nobody feels comfortable getting up every morning and looking for a mask. Nobody feels comfortable riding around all day with a mask. It's inconvenient for everybody. So it's uncomfortable for everybody. But the plan must include guidance and support for state and local governments, health departments, schools, and community organizations. I come from a part of the country where no education would have been available to my parents had it not been for churches, because the states did not sponsor education for them. My father was not allowed to graduate high school because no high school was available to the students in the county he grew up in. And so we've got to bring local communities in this. The churches, temples, synagogues, all need to be involved in this. This is not excluding any religion. We are trying to bring religious organizations into this effort. And we've got to protect our students and our teachers and not go rushing into reopening schools. Finally, the plan must address the grave inequities this virus has inflicted on minority communities. Our black and brown communities already faced health and wealth disparities before the coronavirus. That's what Ms. Velasquez was getting to in her last line of questionings, particularly when we are dealing with this contagious virus. In the words of Dr. Martin Luther King, Jr., in his letter from the Birmingham City Jail, which I happen to believe, most people may not agree with me on this, but the Bible to me is a timeless document. And I believe that King's letter from the Birmingham City Jail is a very timeless document. He said in that letter, injustice anywhere is a threat to justice everywhere. Dr. King also said, and I quote, in that same letter, time itself is neutral. You may recall, he was responding to a letter that he had gotten from 8 non-black ministers who said to him they agreed with him, but the timing was not right. King in his response says, time itself is neutral. It can either be used destructively or constructively. And then he went on, more and more I feel that the people of ill will have used time much more effectively than the people of goodwill. This destructive virus, while it has no will, has used the past 6 months to spread more than 4 million of our fellow citizens. It's spread to more than 4 million of our fellow citizens. To prevent more lives from being lost, people of goodwill, including those who are here today, I consider you to be among the people I respect most in our government. People of goodwill must use their time constructively to combat the virus much more effectively than it has been to this point, irrespective of how many tests we may give, irrespective of how we may shape up to the rest of the world. The question for us is, are we using our time constructively? People of goodwill must correct past mistakes, embrace the science, work together in a bipartisan way to defeat this grave threat to our country. And if I might quote Dr. King once more, the time is always ripe to do right. Without objection, all members will have 5 legislative days within which to submit additional written questions for the witnesses to the chair, which will be forwarded to the witnesses for their response. I ask our witnesses to please respond as promptly as you are able. And with that, this hearing is adjourned.